Yeah, it's great.
Enter the room.
Hello, I'm Dr. Gunratna, one of the foundation year doctors in GP surgery. Are you Jaden Albers?
Yes, doctor, I'm Jaden.
Okay, Jaden. Could you please tell me, confirm your date of birth?
Oh, well, I'm 50 years.
And how would you like to call you?
Jaden's fine.
Okay, Jaden. From my note, I can see that you have been on treatment for venous ulcer, and also you have been on compression stockings. How have you been so far?
Well, doctor, I don't think the bandages are working. I don't want to wear them anymore.
Okay, so before we are starting with the discussion, I would like to ask few more questions to get a better picture and ask few questions to clarify what need to be discussed right here to guide you for the right management. Is that all right?
Yeah, sure.
Okay, so from this consultation, what do you have any special concerns I should address here?
Well, I find the stockings very uncomfortable, and it's very difficult to wear. And I don't think it's doing anything. I still have the wound on my leg.
Okay, so anything special you think that I should do for you today?
Yeah, I mean, if you can refer me to somebody that, can give me a better management, I don't think this is working for me. I mean, if you can, tell me if something else that I can do.
Okay, Jaden. So I would ask few more questions regarding your background, medical check, and how this has been happened so far. So could you please tell me when was you first diagnosed with this condition?
Oh, well, I had the ulcer about 2 months back. Yeah, and I was advised to wear this packet and wearing it since.
Oh, okay. What were the symptoms at that initial moment? Apart from the ulcer, do you have any leg pain, any tortuous dilated veins?
Yeah, I had these, the veins, right? So and then it grew into this wound, and the doctor first told me that it was an ulcer due to this, the veins. Yeah.
Okay. What sort of investigation they done at first place? Like, did they do any scans or have they measured the test called ankle brachial pressure index?
Yeah, I'm not sure about all that. They just did the scan. Yeah.
Okay.
Like
Oh,
veins.
okay. Then afterward, did they advise you regarding this compression stockings?
Yeah, that's what I said. Yeah, they told me to wear it.
Okay.
So
Okay. You mentioned that it was a bit uncomfortable. It means, is it too tight?
yeah, it is. It's difficult to actually put on.
Okay. So do you feel like when you're putting on your toes are a bit tingling sensations, or it's a bit uncomfortable and painful while you're wearing that?
Well, the wound is kind of, it kind of gets itchy, and it kind of
Oh,
gets irritated. Yeah.
okay. So have you used these compression stockings as usual in the way that they have advised you to do, or you use it on and off manner?
I don't know what the off manner is, but I'm doing what they've told me.
Okay, so apart from that, do you have any other particular concerns with regard to this?
Yeah, I mean, sometimes I see that there are some yellowish fluid that's coming out of the wound, and I feel that my skin, around it, kind of getting a little more darker. I'm not very happy with that.
Okay, do you have any fever?
No, doctor.
No, and any lumps, bumps in the groin area?
No.
Okay, do you have any swelling in the calf area?
Not.
Okay, thank you very much. And have you ever been diagnosed with any other medical condition?
No, not really.
Any allergies?
No.
Any regular medications other than this?
Not really, nothing. Just those talkings. I'm not taking any medicines.
Okay, okay. Thank you very much for sharing all the information. I would like to examine your leg and assess your ankle brachial pressure index, and also would assess the inspection, assess the temperature and any discharge or wound infections. And then is there anything from the examination? Yeah, from my assessment, I can see that your ankle brachial pressure index is 1, and your peripheral pulses are present, and I can see your leg is little bit brown, red brown color, and also skin is bit tight. And ulcer is with the irregular
2 minutes
margins and
remaining.
shallow margins. And there's no obvious signs of infection. So I would like to discuss regarding what should be the management. Do you like to know about it?
Yeah, sure. Yeah, absolutely.
Okay. Okay, venous ulcers happen just because blood pooling in the lower leg because of the incompetence valve in the vessels of the lower leg, which draws blood towards the heart. And this, in your case of ulcer, because of this blood pooling, the ulcer healing is a bit affected. So that's why the compression stockings is the first line management. And as in your case, we feel it like it's a bit tight. So I will advise you to use for the right size of the compression stockings, used for about 4 to 6 weeks time, and then we'll monitor your progressions, how this happens over this 4 weeks time with the follow-up clinic. And if it is worsened, we can refer you to the vascular tissue nurse to the wound care, and also we will refer you to the vascular surgeon to assess the venous sufficiency and the blood flow of the legs, and do something related to the blood flow, treatment related to the vasculature. How that sounds to you?
Yeah, wow,
Okay,
that was
then
sure. Yeah, so what
yeah,
do I do in the
I will provide you the right side stockings at first, and then we will monitor in the 4 weeks time, and I provide you the leaflet with regard to all the information, so you can read on that. And if any concerns, please do come back. And at any point you feel like you're having the back of the calf pain or any ongoing fever, please do come to the A&E as well. And depending on that, we will think of the further referral.
Move on to the next station.
All right, Dr. Naranga, thank you so much. Good job. Yes, but one thing I want to tell you, that your data gathering went a little too long, towards the end, and you were repetitive questions. And that's going to really hurt you, because by the time you're coming to management, it's no more a conversation, you're just stating things one after the other. I mean, yeah, due to lack of time, but try to ask questions more, more concised and adequately, so that you have adequate time for the management itself. Yeah, does that make sense? All right, so let's talk about venous ulcers. So you mentioned something along the lines. Yes, Dr. Kumar, I see Dr. Kumar has raised his hand. Please, yes, go ahead.
Yes, the thing is that I want to add one thing, that instead of telling, it is very easy to say that we have to ask, we have to give time. But I think if we can involve, if we can repeat the conversation, like how the patient should tell, how the doctor should tell the patient in which words he should like phrasing the words. So it is very helpful for us. So like the doctor said, so I shall take only 2 to 3 minutes, like the diagnosis is made. So then we have to ask the patient, so do you have any idea about this? We have to explain the diagnosis. Right. And we have to tell them if it is treatable, not treatable. Okay, so that, we usually what doctors say, am I clear so far? But they never, they hardly ask, do you have any questions till now?
Hi, Dr. Kumar. I just want to interject there. So we are going to be discussing that. So let's discuss that in detail, and then we'll have a little more opinions. Yeah, sure. But thank you for the give the advice. So, but yes, absolutely, as Dr. Kumar mentioned, how do we actually get to the point quickly, right? So always when you're actually starting the conversation, start with an open-ended question, that is very necessary. And I think you did a great job when it came to that. So you spoke about, how have you been? That's a very straightforward, open-ended, very generalized question. So they'll actually start, mentioning all the issues that they've been having. And then one by one, you can actually start exploring the issue, like what is it with the compression stockings that you're finding difficult? Could you please explain what exactly is happening there, right? So what is the purpose of actually giving the compression stockings? But before that, let's talk about, the candidate information as such. So if we can see in the candidate information, all what all have been given to you. So always leverage the information that you have from the candidate information to make consultation concise, so that you can get to the point. In fact, what you can do is you can actually ask questions that you have in the candidate information, use them so that you don't ask it in a question sort of a fashion. So I can see from my notes that you've had this also for 2 months. Is that correct? Could you tell me a little bit more about it? Right. So that is actually, reducing one question from your end, which is actually pretty good. Right. And another important information is ankle brachial pressure index. So what do you understand by ankle brachial pressure index, guys? Anybody has any, opinions on this? Like, why do we do this for a venous ulcer? Anyone?
Before applying the compression stockings, because if it is less than 0.8, it means the blood supply is insufficient and it can worsen the condition.
Absolutely, that's absolutely correct. In fact, ankle brachial pressure index actually, is done to see if there are any peripheral arterial disease. All right. And if you have a peripheral arterial disease and if you give compression stockings on top of that, it will actually compromise the blood supply. So anytime you are giving compression stockings, you have to make sure that the ankle brachial pressure index is all right. It is 0.8 or above. All right. So the normal one is around 0.8 to 1.3. So that's exactly what you need to understand. Are there any, arterial problems? Because if there are any arterial problems, you will not be giving compression stockings. So, the first thing that you have to think of, like, why is he having any discomfort? The worst thing that can happen from this compression stockings is any, arterial insufficiency. So that is already ruled out in your, so it's already given in your special notes. So you already know that, this person doesn't have any arterial insufficiency. That's good, isn't it? So now move on to that. You asked me a question regarding that again. See, that's actually eating into your time. So as you already know that, as you already know the results of that, you can move forward with the conversation, right? Rather than asking, did you get any test done like that? Like, I mean, at this point, you actually know that you've gotten a test done, right? So you can actually mention that instead of actually saying, did you get any test done? But so how do you actually, understand? So what is the venous insufficiency? Why do we have venous insufficiency in the first place? Like, what causes that? So you mentioned there is a valve defect. Absolutely, valve defect is one cause. Anything else that anybody can think of?
Intra-abdominal pressure, that intra-abdominal organomegaly that compress the inferior vena cava, the lower blood vessels.
Yeah, let's call it obstruction, right? Any obstruction that actually prevents the venous flow can actually cause any kind of tortuous veins, distal to that. Yes, absolutely. And also there is another aspect. So we have like something called the peripheral heart. So basically your calf muscles, your calf muscles actually function very, much towards actually improving the blood flow in your limbs, especially your gastrocnemius and your soleus. So the contraction of these muscles are also very good, especially when it comes to the circulation of venous blood. right? So any issues in all these three, if you have valve incompetence, obstruction, or if your calf muscles are not working properly, you might actually end up getting um, varicose veins, right? And one of the complications of varicose veins is the venous ulcers. So you're trying to reduce that, venous pressure, the fluid buildup, So what happens when the fluid builds up? Right, so there is a lot of positive pressure from the vessels, from within the vessels. So all the blood from inside kind of oozes out, right? And as it's oozing out, it causes a lot of destruction along the sides. You get all leaky vessels, and that's when you actually start having this kind of an appearance. Yeah, this kind of an appearance. You see this. This is very classically seen with a venous ulcer. Does anybody know what this is called? It's actually called an inverted champagne bottle appearance. But do you understand what this is? Anybody knows what this is called? This clinical sign?
Something called as some lymphosclerosis, something. I'm not able to recall well.
It's basically it's called lipodermatosclerosis.
Yeah, lipoderma. Yeah, exactly. Yeah, right.
Basically destruction of the fat around. Right, and over time you actually become sclerosed, so that's why you have like that tight kind of an appearance. It's very classically seen along with venous ulcers. All right, so these are actually signs that is indicating that the patient's valve, I mean the what to say, the venous circulation is incompetent here. Right. So now usually, so now let's look at the progression of this patient. So this patient has been, having this past 2 months, isn't it? So, and in these 2 months, he hasn't actually improved. So what are you going to do next? Even with the compression stockings, it feels like, it's kind of getting, it's tight, it's uncomfortable. So it looks like it's not the right size. That's good. That's good. Reducing the size is a good option. Yeah. But, let's understand a little bit more about the ulcer. How is the ulcer been? Has it gotten worse? Have you seen that it's increasing in size? Has it reduced in size? Because you're trying to understand with the given management, has it actually improved? Has any of, any symptoms that you actually came in with, or the treatment that was given to you, has anything improved? Right? So this is very important, because now you're going to be thinking about further management. What to do if the compression stockings are not working? What are you going to do? Isn't it? So that's when you actually start, considering a referral. So most of the vascular surgeons, I mean, in some of the literature out there, it's seen that early intervention, especially when it comes to venous compromise, is actually good. Early surgical intervention, I mean. All right. It's actually beneficial for the patients. And by early, I mean within 2 to 3 months. If there are no changes to the current condition, or if the condition starts getting worse, actually referring them to a vascular surgeon at this point for surgical intervention is very beneficial for the patient. So what kind of a referral would you be making? Anybody? You know all the different types of referrals, right? So what kind of a referral are you making? Do we have any suggestions? Anybody wants to answer? Jump in and answer. All right, so this would be a routine referral, because at this point there is no immediate urgency, there is no immediate threat to life, isn't it? So this would be a routine referral that you'd be referring for. Yeah. So those are all the issues. Yeah, those are the questions that you need to ask, and find out a couple of risk factors. And what are the one risk factor that you need to understand about this patient? Is smoking. Smoking is a big risk factor, especially when it comes to any vascular impairments. All right. So aim that your data gathering manages to cover all these aspects. Meaning, how is your current conditions? What is your current issue? How is your current condition? Right? Do you have any risk factors? Yeah. And has your condition improved from the first time you actually, from the first presentation of, from its first presentation? Right. So understanding all these aspects about, the patient, the data gathering, and also impact on life. How is it actually impacting your life? That's also important, data that you need to gather. So once you actually understand all this, now move on to management. So manage all the issues that you have found with this patient. That number one, the stockings are not comfortable, so you can actually go down to a lesser size. So there is another, there is a medication that you can give in this case. Anybody knows any? So that is the conservative the supportive management. They're actually changing the stockings. What is the medical management? Can you give any medications in this case?
Pentoxifylline. I'm not sure.
It's actually right. It is right. It actually improves the venous circulation. Yes. And it improves the healing process as well. So yes, you can give pentoxifylline in this case. So you can, and this is something that you can actually give in the, GP surgery as well. So until the time they are awaiting the surgery. Yes, Dr. Natasha, you have a question? Go ahead.
Please repeat that drug. I didn't catch it.
It's called pentoxifylline. Yeah. So it actually improves venous circulation, and it also reduces, any what we say, oxidative damage, stress to the surrounding tissues, right? So it is actually seen that it has a lot of benefits, especially when it comes to venous ulcers, right? So there is another medication that you can give for PAD. Does anybody know that? I think it's there in the questions today. Am I correct? All right, never mind. So it's okay. I mean, if you don't know the medications also, it's fine. It's absolutely fine. Give what you can. If you have the knowledge for it, go ahead and give what you can, right? But don't say anything that is actually wrong. That is one thing that you have to make sure. Like if you don't know something, it's best not to even bring it up. All right. So there is a supportive management, there is a medical management, and further, what is your ultimate management? You have to make sure to refer this patient to vascular surgeons, for further interventions, isn't it? So what are the further interventions that you can actually be doing in this case? Anybody? What is the surgery for this? Yes. What is the treatment given for, the venous ulcers? So basically, you are going to do sclerotherapy, right? So you're going to be, making sure that the veins that are causing, the venous insufficiencies are kind of blocked, right? So that is the mainstay of treatment when it comes to, surgical treatment. Yes. All right, so you started with confirming age, you acknowledged the patient's frustration and validated emotional response to show the healing process. Yeah, validate emotional response to the slow healing process. I'm sorry. Elaborate the presenting complaint using Socrates to assess the ulcer comprehensively. Ask about the change in symptoms like increased pain, discharge, odor, or swelling to detect any complications. So this is what you're actually trying to see, has it gotten infected? Is it increasing in size, right? And what is the one thing that you can actually advise them, if they have prolonged standing, actually advise them to avoid standing on a prolonged period of time, because that is something that actually worsens this condition. So leg elevation is also a very good, supportive management you can actually offer them, right? Do mention that as well, and try to understand if in their day-to-day routine they have any instances where they have to stand for a very long time, so you can actually advise them against it. Yeah. Assess compliance to the stockings and explore any practical challenges. I think I'll give you a yes, because last time also you did ask that. Inquire about previous ulcer and chronic, venous disease, diabetes, any autoimmune disorders, to identify contributing comorbidities. Yeah. Ask about current medications and known allergies to identify any factors impeding healing or contraindications. Explore family history of venous disease or clotting disorder um, as a contributing risk factor. Yeah, any family history basically. Ask about lifestyle factors such as smoking, alcohol, prolonged standing, exercise habits, and diet, because these are all the supportive things that you can actually offer. Yeah. Assess the impact of the ulcer on daily activities and quality of life, including work, mobility, and sleep. Yeah. Sometimes they can actually have pain even while rest, so you need to understand, if it's actually causing that. Explain the current diagnosis of a non-healing ulcer and clarify why the healing is delayed despite compression, because that is the mainstay of treatment that you've actually offered 2 months back, right? So, understand and tell him that, probably, this is ineffective for you at the moment. So we'll try to give you, because maybe it's too tight, that could be one of the reasons. We'll try to give you, a lower size so that, it's not that uncomfortable for you. And along with that, the medical management, if you can think of it, right? Or else also some of the supportive management, what you can actually give them, right? To reduce prolonged standing, keep your leg elevated, right? Order appropriate blood investigations like full blood count, ESR, CRP, HbA1c, albumin, A&E to rule out infection, inflammation, and poor nutritional state. Right? Offer paracetamol or other appropriate analgesics for symptom control and comfort. Yeah, so at one point he was like, yeah, it's kind of uncomfortable. I mean, I do find it, kind of discomforting. So, that is one thing, that's one issue that you've identified with this patient, that, he is feeling pain to a certain extent. So you can actually assess by asking, how is the pain, right? How severe is the pain? And accordingly, you can even manage the pain. So that is one differentiating factor when it comes to venous ulcer as well as arterial ulcers. Arterial incompetencies can also cause ulcers, by the way, right? And one thing that you can actually, if the pain is severe, it's more indicative of an arterial ulcer as compared to a venous ulcer. Yeah. And discuss alternative compression options like Velcro wraps or lighter stockings if current one is uncomfortable. Yeah. Recommend recommend adjunctive treatment with pentoxifylline to improve circulation and support wound healing. Refer to tissue viability nurse for expert wound dressing and assessment for assessment of ulcer care. Arrange routine referral to the vascular team for potential surgical or advanced interventional assessment. Yeah, that's good. Yeah, you said laser ablation, sclerotherapy, foam sclerotherapy, actually, particularly. Advice on lifestyle modification, leg elevation, regular movement, weight loss, if overweight, and avoid trauma to the affected leg. Advice against smoking and alcohol as they can delay the healing process. Provide leaflets about the venous ulcers and compression stockings and tips on managing symptoms at home. Safety netting, advise the patient to seek immediate help if they notice any signs of infection, arterial insufficiency. How would you actually mention the arterial insufficiency? It's basically the claudication pain, right? So if you actually see that the wound is getting worse, if it's infected, if it feels warm, if it's increasing in size, if you have any odorous discharge, and if you see that if you've been having calf pains, especially when you walk or even in rest, right? So that's how you actually identify or safety net against arterial insufficiency. Or new ulceration, increased pain, redness, swelling, pus or fever. Schedule a nurse review in 2 days to ensure a better stocking fit, and a GB follow-up in 2 weeks to assess the healing. Yeah. Use sensitive language, empathetic language throughout the consultation, signpost the conversation to keep the patient informed and about the next step. Address the patient's concerns and expectations by providing clear explanation and reassurance. ensure the patient understands the management plan and the importance of follow-up, offer continuous support and encourage the patient to ask questions or express any further concerns, address the patient's concerns directly as a frustration with treatment or fear of worsening symptoms, invite questions and offer ongoing support, reassuring the patient that they are being monitored and supported throughout the treatment process. Yeah, this was your first attempt, so
Please like and subscribe to Turing Med School. Good luck with your preparation.